Did you know that something as simple as taking your daily medication could be putting you at risk for anemia without you even realizing it? Anemia in seniors is a serious issue, often silently creeping up, and the medications you take for common health conditions could be making it worse. A study published by the National Institutes of Health, NIH, found that untreated anemia in seniors significantly increases the risk of cardiovascular disease, including heart attacks and strokes. In today's video, I am going to uncover 3 common medications that could be quietly robbing you of the red blood cells your body needs to stay strong. These drugs could be doing more harm than good when it comes to your blood health. But don't worry, I'll also share simple tips to protect yourself and ensure that your health is in the best possible shape. Before I get started, take a moment to hit that like button and subscribe to Golden Aging Health for more expert-backed, easy-to-understand tips to help you live your healthiest life. Trust me, you don't want to miss what we're about to uncover. Now, I'll be discussing the first medication on our list and the surprising role they play in causing anemia. Medication number 1. Proton pump inhibitors, PPIs. It's common for many older adults to reach for medication when dealing with heartburn, acid reflux, or stomach ulcers. You might take your pill every morning without a second thought after all. It's helping you feel better. But what you might not realize is that this simple habit could slowly be draining your body of something essential: red blood cells. Why? The medications in question are proton pump inhibitors, or PPIs. These include popular drugs like omeprazole, Prilosec, or esomeprazole, Nexium. You've probably seen them on pharmacy shelves or had them prescribed by your doctor. They work by reducing the amount of acid in your stomach, which seems like a good thing, right? A 2011 study published in the Journal of the American Medical Association, JAMA, found that individuals who took PPIs for 2 years or longer had a 65% increased risk of vitamin B12 deficiency compared to non-users. The mechanism? Stomach acid is crucial for releasing B12 from food so it can be absorbed in the small intestine. Well, here's the problem. Stomach acid plays a key role in helping your body absorb nutrients like vitamin B12 and iron, both of which are critical for making healthy red blood cells. Without these nutrients, your body can't produce enough hemoglobin. And over time, you may develop anemia often without even noticing the signs at first. Let me tell you about Linda, a 72-year-old grandmother who had been taking a PPI every day for years to manage her acid reflux. She never questioned either doctor said it was safe, and it kept the burning sensation away. But slowly, she started feeling tired all the time. She couldn't walk as far without getting winded, and she'd find herself needing to nap during the day, even after a full night's sleep. At first, she thought it was just getting older, but a routine blood test revealed that Linda was anemic. Her vitamin B12 and iron levels were well below normal. The culprit? Long-term use of her PPI. Without knowing it, she had been blocking the absorption of vital nutrients her blood needed to stay strong. What could Linda have done differently? She could have checked in with her doctor every few months to monitor her B12 and iron levels. She might have asked whether a lower dose, a shorter course, or an alternative medication would be safer for her in the long run. And if she had known about the anemia risk, she might have started supplementing earlier, possibly avoiding years of fatigue and weakness. So, here's what you can do. If you're using a PPI, especially long-term, don't panic but do take action. Ask your healthcare provider about checking your nutrient levels. And never stop medication suddenly without medical advice. With the right monitoring and small adjustments, you can protect your digestive comfort and your blood health at the same time. Have you or someone you know been taking PPIs? Did you ever notice symptoms of fatigue or weakness? Let me know in the comments. I'd love to hear your story and help you get the answers you need. Coming up next, we're going to talk about a second type of medication that millions of people take for pain relief but may be silently causing internal bleeding and anemia. Don't miss this. Medication number 2. NSAIDs. You feel a little ache in your knees, a twinge in your back, or some stiffness after gardening, so you reach for an over-the-counter painkiller. Maybe it's ibuprofen or naproxen. It helps, and you go about your day. But what you might not realize is that regular use of these pain relievers could quietly be putting you at risk for anemia. We're talking about NSAIDs, or non-steroidal anti-inflammatory drugs medications like ibuprofen, Advil, Motrin, naproxen, Aleve, and even some prescription versions. They're widely used by older adults to ease joint pain, arthritis, and everyday inflammation. But here's the thing. NSAIDs can irritate the lining of your stomach and intestines, sometimes even causing small amounts of internal bleeding, so small you may not even notice it. But over time, that hidden bleeding can lead to iron deficiency anemia. According to the American Gastroenterological Association, chronic NSAID use is one of the leading preventable causes of anemia in adults over 65. Robert, a 74-year-old retired school teacher who took ibuprofen every day for his arthritis. It was part of his morning routine: wake up, stretch, take his pill, then get moving. He didn't think much of it, but over the months, Robert started feeling more sluggish. He was winded after walking short distances and needed to sit down more often. At first, he thought maybe he was just slowing down with age, but during a visit to his doctor, a blood test revealed that his hemoglobin levels were low. Further tests showed traces of blood in his stool, signs of slow, chronic gastrointestinal bleeding from NSAID use. What was really happening? Robert's NSAIDs were doing their job on his joints but quietly damaging his stomach lining. The tiny amounts of blood loss added up over time, draining his iron stores and making it harder for his body to produce red blood cells. His fatigue wasn't aging, it was anemia. How could Proton you do differently? You don't necessarily need to give up NSAIDs completely, but it's crucial to use them wisely. Take them with food to reduce stomach irritation. Avoid using them daily unless directed by a doctor. Ask about alternatives like physical therapy, topical pain relievers, or lower-risk medications. And most importantly, get your iron levels and blood count checked regularly if you use NSAIDs often. Even low-level blood loss can add up quietly over time. But with awareness and proper monitoring, you can manage pain without sacrificing your blood health. If you know someone who relies on painkillers every day, share this video with them, because even a small shift in how they manage pain could protect them from serious blood loss and anemia down the road. Finally, I'll reveal the third medication that could be silently affecting your red blood cell levels and what you can do to stop it. This one might surprise you. Medication number 3. Metformin. For millions of older adults living with type 2 diabetes, taking metformin is just part of the daily routine. It's often the first medication prescribed after diagnosis, and for good reason. Metformin is widely considered safe and effective, but what many don't realize is that long-term use of metformin may come with a hidden cost to your blood health: anemia. At first glance, it doesn't seem concerning. After all, metformin helps lower blood sugar levels and reduce the risk of diabetes-related complications. But here's what's important to know. Over time, metformin can interfere with your body's ability to absorb vitamin B12, a critical nutrient for producing healthy red blood cells. Low B12 levels may go unnoticed for months, even years, but eventually, they can lead to fatigue, memory problems, nerve damage, and most importantly, anemia. A 2016 study published in the Journal of Clinical Endocrinology and Metabolism found that nearly 1 in 5 long-term metformin users developed a vitamin B12 deficiency, putting them at greater risk for anemia and cognitive decline. I once met Eleanor, a 69-year-old woman who had been managing her diabetes well for years with the help of Metformin. Eleanor took pride in staying on top of her blood sugar. She ate healthy, stayed active, and never missed a dose of her medication. But despite doing everything right, she started to feel drained. Her memory wasn't as sharp. She felt tingling in her hands and feet. She thought maybe it was just aging or maybe she was doing too much. Then, during a routine blood test, her doctor noticed something off. Eleanor's red blood cell count was low. Further tests revealed a B12 deficiency. And the likely cause? Her long-term metformin use. What happened to Eleanor happens to many, but it doesn't have to. Metformin didn't fail her, but she hadn't been told that this helpful medication can block B12 absorption in the gut. Without regular monitoring, the deficiency snuck up quietly, draining her energy and affecting her health. So, what can you and Eleanor do to prevent this? If you're on metformin, especially long-term, ask your doctor to check your vitamin B12 levels at least once a year. It's a simple blood test. If your levels are low, your provider may recommend a supplement, dietary changes, or B12 injections. Making this one small adjustment can help you maintain the benefits of your diabetes treatment without compromising your blood and brain health. Been taking metformin for years, or know someone who has? Noticing signs like fatigue, numbness, or brain fog? These symptoms might not just be from aging, they could be linked to B12-related anemia. Drop a comment in the comments if this sounds familiar, and tag a friend or loved one who should get their B12 levels checked. Let's take a moment to review the 3 common medications that could quietly be contributing to anemia. Proton pump inhibitors, PPIs, NSAIDs, and metformin. These medications are widely used and often necessary, but long-term use can interfere with nutrient absorption, cause internal bleeding, or trigger vitamin deficiencies that lead to anemia. The symptoms can creep in slowly: fatigue, weakness, shortness of breath, and are often mistaken for normal aging. But catching these issues early can make a big difference. By staying informed, monitoring your blood levels, and working with your healthcare provider, you can continue using the medications you need while also protecting your red blood cells and overall health. You don't need to overhaul your lifestyle. Just simple actions like taking meds with food, asking for regular blood tests, and staying alert to unusual fatigue can help you stay stronger, longer. Don't forget to like and subscribe to Golden Aging Health for more trusted, science-backed tips to help you stay energized and independent through your golden years. And be sure to share this video with a friend or family member who takes any of these medications. It could be the heads-up they need to prevent anemia before it starts. Want to learn more about medication, safety, and energy tips for seniors? Check out our Senior Anemia playlist, linked in the description. Thanks for watching. Take care of your blood health, and I'll see you in the next video.